understand that we only have 3 minutes. Is that correct?
Yes, if we can keep it to 3 minutes, we would appreciate it. Now,
I'm hoping that I could use my wife and I in tandem and use 6 minutes, maybe.
Okay, let's see how much we can get done here. Okay, thank you.
My concern and curiosity was recently elevated after reading information concerning fluoride on the websites of the Health and Human Services and EPA. Going to these sites, I found this paper on the Health and Human Services. It says that fluoride ingestion while teeth are developing can result in a range of visually detectable changes in tooth enamel. The period of possible risk for fluorosis in the permanent teeth, excluding the third molars, extend from about birth through 8 years of age. When communities first began adding fluoride to the public water system in 1945, drinking water and food and beverages prepared with fluoridated water were the primary sources of fluoride for most children. Fluoride intake from these products, in addition to water and other beverages and infant formula prepared with fluoridated water, have been associated with increased risk of dental fluorosis. I have that article here, and I'm going to leave that with the City Council if you don't mind. The second article was in January 7th of this year, 2011, from the same site, Health and Human Services. And in it says, the Health and Human Services is proposing that recommended levels of fluoride in drinking water can be set at the lowest end of the current optimal range to prevent tooth decay, and the EPA is initiating review of the maximum amount of fluoride allowed in drinking water. And this is to reduce the possibility of children receiving too much fluoride. EPA's new analysis will help us make sure that the people benefit from tooth decay prevention while at the same time avoiding unwanted health effects from too much fluoride. Development of dental fluorosis may occur with excess fluoride consumption during the tooth-forming years, age 8 and younger. Americans have access to more sources of fluoride than they did when water fluoridation was first introduced in the United States in the 1940s. And like I said, I have both those articles here. So anyway, I began doing a little digging. First of all, I wanted to know whether the substance was a drug or a poison. The EPA refers to it as a compound. Loveland City calls it contaminant. Interestingly, the EPA never refers to it as medication, even though it is being used as one as defined by the EPA's own definition, and can be further illustrated in a letter to Diamond Foods Incorporated from the EPA. And this is an actual letter that I found on the FDA's webpage to Diamond Foods in California, which makes walnuts. Well, that grows them. In that letter, some of the highlights, it says, based on claims made on your firm's website, we have determined that your walnut products are promoted for conditions that cause them to be drugs. Because these products are intended for use in the prevention, mitigation, and treatment of disease. It goes on further to say that based on our review, we have concluded that your walnut products are in violation of Federal Food, Drug, and Cosmetic Act, and it gives all the legal terms for that act. And then it says, because of these intended uses, your walnut products are drugs within the meaning of section so-and-so, attorney stuff. And lastly, additionally, it says, your walnut products are offered for conditions that are not amenable to self-diagnosis and treatment by individuals who are not medical practitioners, therefore adequate direction for use, and it does say that you just eat walnuts, but it says adequate direction for use cannot be written so that a layperson can use these drugs safely for their intended purposes. After additional digging, I discovered that fluoride is actually listed as a poison on the material safety data sheet. And I picked up the material safety data sheet from the web pages, and this is for sodium fluoride. And in section 3 of hazards identification, it says that the substance may be toxic to kidneys, lungs, and nervous system, heart, gastrointestinal tract, cardiovascular system, bones, teeth. Then also it says repeated or prolonged exposure to the substance can produce target organ damage. But most importantly, it says related Repeated exposure to a highly toxic material may produce a general deterioration of health by an accumulation in one or more human organs. I felt that to be very enlightening. I also discovered that the ADA, American Dental Association, had a web page, and it had information in 2007, and they had an issue with fluoride. The ADA, in this article, it says, I'll leave a copy with you guys also if you like. The ADA offers these recommendations to reduce fluoride intake from reconstituted infant formula. Breast milk is widely acknowledged as the most complete form of nutrition for infants. For infants who get most of the nutrition from formula during their first 12 months, ready-to-feed formula is preferred to help ensure that their fluoride intake does not exceed the optimal amount. If liquid concentrate or powdered infant formula is the primary source of nutrition, it can be mixed with water that is fluoride-free or contains low level of fluoride to reduce the risk of fluorosis. Parents should not use fluoride toothpaste in children younger than 2 years because they may inadvertently swallow the toothpaste. Children 2 years or older should use an appropriate sized toothbrush with a small brushing surface and only a pea-sized amount of fluoride toothpaste. And it doesn't recommend rinsing with mouthwash that has fluoride in it, because children may inadvertently swallow that also. Interestingly, or most interestingly, I discovered that fluoridated drinking water contains up to 200 to 250 times more fluoride than mother's breast milk. The figures are 1,000 parts per billion in fluoridated tap water, compared with 5 to 10 parts per million in mother's breast milk. Excuse me. The city of Loveland, according to the 2009 water quality report, and I'm finishing up here real quickly, people. In 2009, the water quality report shows 0.78 parts per million, but the average daily in-house test shows 0.85 parts per million for the year 2008. So I'm suggesting that the city of Loveland should err on the side of caution and remove fluoride completely from the water supply, but absent a bold decision such as that, we should at least add a note in our water bill, or even to the Loveland City update, something that says your public water supply is fluoridated. When feeding infants under 12 months of age, the American Dental Association and the Center for Disease Control and Prevention recommend that liquid concentrate or powdered infant formula be mixed with water that is fluoride-free. Consult healthcare providers for more information. Or we can say something simpler. Your public water supply is fluoridated. Fluoridated water should not be used or added to infant formula, food, or drink intended for babies 12 months of age or younger in order to avoid dental fluorosis. And this, I submit, would make every day a Children's Day and a children's celebration for every day. I believe nutrition, education, and oral hygiene are the most critical factors for healthy teeth, not fluoridated water. I believe it's time to discard belief and biases, or blind beliefs and biases, and do what's morally and medically right. Turn off the fluoride tap. Here I have a tube of Colgate, and in it, the EPA requires on the back and on the tube a warning. I had it blown up because I couldn't read small writing. It says, keep out of the reach of children under 6 years of age. If more than used for brushing is accidentally swallowed, get medical help or contact the Poison Control Center right away. I thought that was very apropos for what I'm talking about here. And lastly, ladies and gentlemen, new technologies are always being discovered, touting claims that are fantastic and supposed to make our lives better, happier, or healthier. I'm happier due to smoking never being made mandatory or enacted as law. Since I don't smoke, I believe I am much healthier. Rest assured, it won't be long before Coppertone, the suntan lotion people, will be in a drinkable form touted to assist in the prevention of sunburn. I don't think we should add that to our water either. In addition to the immorality of forced medication of the citizens of Loveland, hopefully the monetary savings by removing the cost of buying fluoride from the budget might guide us towards a correct decision in this matter. And I thank you for your time. I'm going to leave you guys with some reference books that I got a lot of information from. I hope you guys, if you don't want to read them, maybe put them in the source library or something. One of the books, The Case Against Fluoride, on the back you'll see a comment by Dr. Abbott Carlson, who is a Nobel laureate in medicine or physiology in 2000. And they're very informative and are highly recommended by opponents of taking fluoride out.
Okay. Sir, if you would hand those to our clerk here and leave whatever materials you'd like for us to see with her, and
Thank you very much for your time.
Yes.
Is this on?
Yes, it is.
Thank you. Good evening, City Council members, Mayor, City Council members, City staff, and City Attorney. I'm Diane Walker. I live at 3301 Newcastle Drive in the City of Loveland. I formerly had 15 years